Good morning. Welcome to the Homebodies, where we will help you learn more about your patient's bodies from home. I'm Eleni May.
I'm Rachel Beckman.
I'm Sienna Kriegish.
And welcome. All right, so we had our first phone call this morning for our first episode, but unfortunately we missed it. We were in research class. So this person actually left the voicemail. So let me go pull up that voicemail here. All right, here's our phone call.
Hi, you reached the Homebodies. Please leave a message. Good morning, Homebodies. My name is Elizabeth, and I have been having this excruciating pain and stiffness on my right shoulder for 9 months. I don't know how this awful thing started, but it slowly got worse to the point that I cannot sleep on my shoulder. I also keep waking up dear Philip. The pain has improved, but it is still fairly stiff. I cannot raise my arm to put on my hat, wave to my subjects, or drink tea. Most dreadful of all is it's keeping me from playing my beloved pickleball. Do help if you can. I will be most indebted to you.
All right, thank you, caller, for calling in. We're gonna do our best to help you out. So can't quite put my finger to it, but this person sounds familiar to you.
I think I know who it might be. I'm pretty excited to work with them.
Okay,
I hope we can help her out.
Well, we'll figure it out. Maybe we can give her a call later. She left the phone number. All right, so to me, this sounds a little bit like frozen shoulder. What do you think?
I'd have to agree. I think the symptoms are pretty similar. Everything I know about adhesive capsulitis, which is, a ton. But, her age, my guess in her age, her voice sounded a little old, and who I think it is.
Mm-hmm.
Her pain, stiffness, the fact that her grooming is limited and putting on her hat, potentially. I've never really heard of pickleball. Not sure what that is, but I'm sure there's some movement that might be associated with it. And I guess they say if it smells like or looks like a horse, it's a horse. Don't try and think it's something else. So I think it is.
I think I agree with you on that one. Unfortunately for us students, we have the CPG here to help us with the treatment of this person and the diagnosis. So I agree with you. The impairments are similar to what we would see with someone with adhesive capsulitis. Activity limiting in all directions. It seems like external rotation is the most limited, right? So putting on her hat, waving, seems like it's one of them, as well as drinking tea. So I think that's also a lot of external rotation, and that the symptoms are 9 months too. So it seems like she could be in the staging process, maybe frozen thawing now that the pain is going away.
Yeah.
So do you think this person is appropriate for PT? That case? No other red signs?
I don't see any red flags here.
We'd obviously want to talk to her a little more before we make that conclusion, but no, so far, definitely want to work with her. Who doesn't want to work with royalty?
Royalty. Okay, so you're on the same page here. All right, so, instability. You think this person could have some indications of instability? We want to rule out a few things here.
Well, it doesn't sound like instability. It couldn't really actually sound further from instability for me. It doesn't sound like her shoulder's just hanging there and she has a lot of range of motion. It sounds quite the opposite. And as far as rotator cuff tears go, we could test for her arc pain in abduction or do a strength test of the rotator cuff tears to see, or the rotator cuff muscles in mid-range for flexion and abduction. If all are pain-free, then our suspicions about adhesive capsulitis are looking pretty good, I'd say.
I agree. I would agree with all of that.
Yeah, her main symptoms are pain and stiffness. She's not saying that she feels weak or anything. So
and it doesn't sound like she wants our help making that any more stable. It sounds like she got a little too much stability.
Yeah, I think so too. All right, so let's get started with our examination then, based on our CPGs here.
Cool. Let's do that. Well, so based on my vast experience working in patients in paper cases in MSK and CCU4, I think I would start with an outcome measure because we want to have somewhere to go, have something to base it off of, see where she's starting at, so we can gauge her improvement throughout it. And luckily the CPG agrees with me on that one because they have some super robust A-level outcome measures that they recommend. We've got the DASH, which is a disability of the arm, shoulder, and hand. The ACES, the American Shoulder and Elbow Surgeon's Shoulder Scale. Never used that one, but apparently it's there. The SPADI, the Shoulder Pain and Disability Index. So we could do any one of those, and the CPG very much supports those to start out. And then after that, unfortunately, there is no more A-level evidence, but I think our knowledge in general on anatomy, physiology, the pathology of this disease kind of lets us know what we should be looking at. We want to check out her range of motion. We want to determine what her level of pain is, because I think we'll discuss in a little bit the stages of the disease, but pain is one of the determining factors on how we're going to determine what her tissue irritability is. I don't know, is there anything else I missed?
Maybe also with range of motion, looking at like her joint accessory motion would be good.
Yeah, that's the GH joints, and that's pretty much what the pathology of adhesive capsulitis is. It's kind of this thickening of the capsule, so we could do that. Anything else? I think that about covers it.
Yeah,
as far as our examination.
Yeah, I think that's a pretty solid examination. Yeah, I would go with that.
Well, that sounds good. So let's say we've examined Elizabeth and things are going well, and they're pointing towards adhesive capsulitis. Have either of you guys treated patients with adhesive capsulitis before?
Mr. Castle.
Carla McCarthy. Small one.
Other than that, no. So what do you think irritability she is? Is she in low, moderate, or high irritability? What do you think we should put her in?
I would put her in moderate irritability. She says her pain's decreasing, so I think that's a sign that she's potentially moving out of severe. She mentions night pain, but it doesn't sound like it's constant night pain. And I don't know, what other factors am I missing?
And then activity limitations. So,
yeah.
I mean, she can't put on her hat, wave. I mean, that's what she does all the time.
Yeah, if she's out of the pain range, we can help her increase some of that range of motion.
Definitely. So based on the CPG, as far as what we would do for interventions, the A-level evidence that's out there says that we should potentially recommend a corticosteroid injection, and then combine that with stretching for 4 to 6 weeks to see if she's able to wave her hand better, drink tea. What are you guys' thoughts on that?
I don't think she would benefit as much.
Yeah, I think she's kind of past that stage.
Yeah, she's not inflamed, which with the corticosteroids would help out. Right now, if the pain's gone away, now she's just more stiffness. I think we could do better with other interventions.
Yeah, that's a valid point. So I agree. Corticosteroids probably won't be great because she's not showing signs of inflammation. It's more stiffness. Based on that phone call that we got. So if that was the case, I would move on to the B-level evidence in the CPG. And it says we should utilize patient education. And that specifically means that we should tell her about her course of her disease. We should be talking to her about the ways to modify her activities, as well as just making sure she doesn't go too hard or too far when she is doing the exercises we recommended. So I don't know, maybe she has like a decorative straw or something she could put in her drink. The ones with the glasses that swirl around.
What does a straw do for?
For her tea.
So she doesn't have to move her arms.
Okay, got it.
Or maybe someone else could put her crown on her head for her or something. I don't know if you have any people.
It's a hat, not a crown. It was a hat.
But going back to the patient education, how would you guys explain the stages of adhesive capsulitis?
Sure, I'll take on that one. So I think one of the main important things to note to the person is while there are 4 stages, it's more of a continuum, and don't get hung up on like each particular stage. They do have characteristics about them, but it's really common for one stage to blend into the other, so your symptoms might not all appear the same, and then we also shouldn't get hung up on them and really treat what we're seeing. But stage 1 is it typically lasts up to 3 months. We don't really think she's in that because she's at 9 months at this point, and really the cardinal sign for that is some loss of external rotation, but with intact rotator cuff strength. There often is sharp pain at end range of motion and some sleep disturbances, which she did mention. Stage 2 is 3 to 9 months, so she potentially could be in that stage, but we did discuss, we're starting to lose some pain, and typically in stage 2, there still is pain, and this is where they're freezing. So there's some loss of range of motion, but not to the worst that they're going to experience throughout the disease or the pathology of this. Stage 3 usually lasts 9 to 15 months. It's called the frozen stage. So this is where we have our max limiters in all ranges of motion, which it sounds like she's reached. So we're kind of leaning towards stage 3, but again, they blur into one another. And then stage 4 would be the thawing stage. That's where you, again, don't have pain and you start to get some range of motion back, but there's still going to be some limiters. So really that's what PT is there for, to have the best recovery through stage 3 and stage 4. If that's where we're at, we can really make some improvements.
Yeah, that was a brilliant explanation. That combined with the other B-level evidence that's in the CPG for this condition is that we need to give her exercises that are appropriate for the level of irritability that she has right now. So I'm thinking, it sounds like we were talking about she had moderate irritability. She seems to be in the stage, the frozen stage, or potentially the thawing stage, where we can actually make a difference. So maybe we could provide her some just moderate to gentle and moderate stretches. See if that helps her out.
This sounds like B-level evidence to me. Yeah.
Huh.
How about should we even consider C-level evidence? What do you think? Some weak evidence out there to help her out? Joint mobs is C-level. I thought that would be higher, but that's C-level. So if she restricted an abduction or external rotation, maybe do some posterior glides.
That's a great idea, and I think it wouldn't hurt, especially if we're able to re-examine and find that she's making progress with that. Also, the fact that modalities could maybe just reduce some of that pain initially at the beginning of our treatment session. Why not use a heating pad?
Yeah, not to mention so many of these interventions, while they might be C-level, it doesn't mean that they don't have good evidence behind them. Sometimes it's just not, they're more like clinical cases and not broad reaching. Doesn't mean they don't work. So it doesn't, it makes perfect sense to do a joint move on her based on, what is actually inhibited. So why not try it? It's not going to hurt, as long as we're not causing any pain, it can only help. So I don't think ever ignore the C evidence, but always look to the strong ones.
I agree. All right. Anything else with this person? Do you think she would benefit from our care?
For like experts. Who wouldn't?
Yeah, I think she would.
Yeah, I hope this Elizabeth lady was listening.
Yeah, so I think she would approve. All right, well, that concludes our session here. If there isn't anything else from fellow homebodies.
No, I think we covered it.
No, yeah, I'm ready for a nap.
Yeah. All right, so we're going to go take a nap. And we want to give special thanks to our one of our favorite instructors here, Dr. Leach, for calling in for our Madame, or Your Highness. And that's a wrap.
Bye.